Hi everybody, I am Dr. Britt Talley Daniel MD, neurologist and headache doctor, and today I'll be talking about migraine headache symptoms for beginners. Pain in the head is universally thought to be a concerning, very bothersome problem. Most headaches, 99% of them, in fact, are either tension type headaches, which are 70% of headache, or migraine, which is 30% of headache. Only about 1% of headaches are something else. Many persons are moderately and some are severely disabled by headaches, and these are usually persons with migraine. Because migraine is more severe, it has nausea and the need to lie down, while tension type headache is just mild to moderate tight pressure headaches. Many persons don't recognize a definite diagnosis for their headaches. They think, it's just a headache. The purpose of this article is to explain migraine headache symptoms for beginners so that they may know and later have it confirmed by a neurologist and negative testing that they have migraine. So migraine headache symptoms for beginners is best explained by stating that migraine is a primary headache problem which comes with repeating moderate to severe headaches. Migraine usually is a one-sided headache which may be throbbing or pulsating and lasts from 4 to 72 hours. Along with headache, many persons have nausea, vomiting, and sensitivity to light, sound, noise, and smell during the headache time. Migraine is found in 12% of the world population, being more prevalent in women, 25%, than in men, which is about 6%. The pain of the headache is made worse by activity, so that many persons with migraine have to lie down and rest or sleep during the attack. The word primary in medicine means that the exact cause is not understood, like primary hypertension, which is a common medical problem with no known cause in about 90% of persons. About 30% of persons with migraine may have an aura that comes before the headache starts. Usually with this, there's a visual aura of seeing stars, zigzag flashing objects, or half of things which move. The aura typically comes just before the headache starts, but it may come in the middle of the headache or at the end of the headache. Sometimes the aura comes with no headache, especially at older ages like 50 to 70 years old, and this is called migraine semi-migraine, acephalic migraine, or silent migraine. Other rare aura symptoms are numbness on one side of the body, usually involving the fingers, hand, arm, and cheek, and then tongue on one side. Some persons have trouble speaking normally and can't produce words or mix up words when talking. Related questions. What's the cause of migraine? Migraine is thought to be due to mixed genetic and familial factors. Certain genes for migraine have been isolated, but migraine is thought to be now a complicated, multi-genetic medical problem. What's the pathophysiology of migraine? This is not clearly understood, but during a migraine, the trigeminal nerve is activated, causing the ganglia of the trigeminal nerve and the cerebral artery to release 3 inflammatory chemicals called neurokinase, substance P, and CGRP. And these neurochemicals cause the cerebral arteries to dilate and then cause inflammation of the thalamus, which is the human brain pain center. These chemicals last in the brain 4 to 72 hours and then drain down into the abdomen to the liver, where they're metabolized and then leave the body in the toilet. On my webpage at www.drmigraine.com, I have a picture of the migraine timing cycle. Why do women have more migraines than men? Part of the reason has to do with estrogen, which female ovaries start to secrete during the menarche, the name of the timing for the first menstrual cycle, which occurs between the ages of 10 and 16. The withdrawal of estrogen during the 3rd week of the female cycle sets off a migraine headache in susceptible women. When is migraine at its worst? The worst time for migraine headache is during the female middle age, like 30, 40, 50. 30 is not really middle age, but you get the point. When does migraine get better? Migraine usually improves after menopause and age 50 to 60 years old. What does a man or woman on the street erroneously call migraine? Migraine has pseudonyms or false names that are used, which prevents many persons from understanding if the headaches they have are really migraine. These false names are sinus headache, menstrual headache, hungry headaches, nocturnal headache, one-sided headache, holiday headache or let down headache or barometric pressure headache. What are one-sided migraine headaches like? The most common of all migraine symptoms is that it may be one-sided. Headache with a migraine may be one-sided or generalized, as often in the front of the head, in the temple, or behind the eyes, or one eye, but sometimes they start in the back of the head and move forward to be behind one eye. How bad did migraine headache get? Considering pain could be quantified on a scale of 1 to 10, migraine headaches are usually over 5 and commonly 8 to 10. Migraines can last 72 hours. A single episode of migraine may last 4 to 72 hours, but headaches lasting longer than that are usually caused by overtreatment. And the common drugs used for overtreatment are caffeine, Tylenol, Advil, Aleve, NSAIDs, opiate narcotic, butalbital type headache drugs, or triptans. In the migraine world, overtreatment may result from using one of the above drugs more than 2 days a week. The principle is that the stronger the drug, like a narcotic, which is stronger than Tylenol, for instance, the less amount of the drug is needed to cause daily headaches. So caffeine, Tylenol, Advil, NSAIDs, over-the-counters, have to be taken 15 days a month for a certain portion of patients to give them what's called daily headaches or medication of each headache. However, narcotics, such as opiate-containing drugs, barbiturate drugs, or triptans, they give daily headaches if taken only 10 days a month. I've heard that migraine has stages. Is that right? Yeah, migraine lasting longer than 72 hours is termed status migrainosus. But there are 4 possible phases to an ordinary migraine, although not all the phases are always experienced. There's the prodrome, which occurs hours or days before the headache. There's the R, which usually immediately precedes the headache. The pain phase, also known as the headache phase, which lasts 4 to 72 hours. And the postdrome, the effects experienced following the end of a migraine attack. So I'm going to go through these and talk about them in detail. Prodrome phase. Prodromal or premonitory symptoms occur in about 60% of those with migraine, and they may come from 2 hours to 2 days before the start of the pain or the attack or the aura. These symptoms may occur in those either with migraine with aura or migraine without aura, and include a wide variety of phenomena such as altered mood, irritability, depression or euphoria, fatigue, craving for certain foods, stiff muscles, especially in the neck, constipation or diarrhea, and sensitivity to smells or noise. The aura phase. The migrainer may see a blind spot, which is a negative scotoma, or positive scotoma, which may be a flickering, scintillating, zigzag pattern of images near the center part of vision. Following the visual images, there may be a tingling or pins and needles feeling in the fingers of one hand, then the hand, then the forearm, then the same side on the cheek and the tongue area. Following this, there may be trouble forming or finding words called aphasia or dysphagia. The aura lasts less than 60 minutes. The pain phase. A typical migraine headache is one-sided, unilateral throbbing, and moderate to severe in intensity. There may be a gradual onset from onset to peak of about an hour or so. The patient feels worse of being up or physical activity. Commonly there may be neck pain associated with migraine. Is also on the same side of the back of the head as the pain in the front of the head if the pain is one-sided. The pain phase comes with nausea 90% of the time, vomiting 33% of the time, sensitivity to light, sensitivity to sound, sensitivity to smells, fatigue, and irritability. These are specific symptoms that go with migraine. Many persons want to lie down in a dark, quiet room. There also may be blurred vision, nasal stuffiness, diarrhea, frequent urination, pallor or sweating. Scalp swelling or tenderness may occur, and elderly patients may have fewer associated symptoms other than the headache and nausea. Postdrome. The migraine postdrome may be a sore head, especially where the migraine was. Impaired thinking for a few days. Feeling tired or hungover, mood changes, gastrointestinal symptoms. Some people feel unusually refreshed or euphoric after attack, while others may note depression and malaise. Well, now that you know what a migraine really is, get medical help and adequate treatment for your headaches from a primary care doctor, internal medicine doctor, or neurologist. If over-the-counter drugs don't work, see a doctor for that sinus headache, which is really a migraine. So, thanks for watching and listening. Please click subscribe down there so we follow each other God bless all you persons with migraine, and I'll see you on the next talk.